the fetus because it passes all the nutrients and oxygen to the fetus as well as removes the waste products.
The system of transport is a network of blood vessels. The mother's blood vessels and the baby's are not directly connected, but it's a short trip across the placental barrier. So food and oxygen travel from the mother's blood over the placental barrier to the baby's blood vessels. The baby's waste products, like carbon dioxide, are given back in exchange. That same route can be traveled by harmful substances in the mother's bloodstream as well, such as alcohol, tobacco, and drugs, including medications.
And many substances that are bad for the fetus do cross the placenta. We used to think the placenta was a significant barrier to many toxins, and we've now learned that it's really not.
Behind every healthy baby is a healthy placenta. It really is the key to a successful pregnancy.
If you have not been careful until now about what you eat and drink, or if you smoke, you should talk about how to change your habits with a healthcare professional who will be guiding your pregnancy.
Now, doctors and nurses we spoke with urge couples to adopt a healthful lifestyle even before they conceive. It's better for the baby and for the mother, who's at higher risk for certain medical problems during pregnancy, such as high blood pressure or diabetes. No matter how healthy you are, some pregnancy-related problems cannot be avoided. Judith Duty has been pregnant before, so she recognized two of the most common symptoms, fatigue and nausea.
I wasn't feeling very well, and I was really exhausted. I took a nap on a Sunday afternoon. I never take naps, and I'm like, geez, I wonder if something's up. I never actually physically became sick, but I did have some severe nausea at times.
Okay, Judy.
It's called morning sickness, though many women feel nauseated other times of the day as well. The nausea, fatigue, and mood swings of the early weeks are all attributed to hormones, which carry messages around the body through the bloodstream.
Many physiologic changes occur in early pregnancy related to the hormones that are produced. Changes in heart rate, heart output of blood, kidney function, all occur very early related to those hormone changes.
Other symptoms that may start early are constipation and gas, frequent urination, food cravings and taste changes, nasal stuffiness, vaginal discharge, or less often, bleeding gums, nosebleeds, and lightheadedness. In the breast, milk-producing glands are stimulated by hormones. As the glands expand, the breasts begin to feel full and tender. Some women, like Mary Clark, notice changes in their breasts before any other symptom.
The only thing was tenderness in my breasts, and I knew I had to be pregnant.
Even if you're certain, your doctor or nurse midwife will want to confirm the pregnancy with a blood or urine test. Like a home pregnancy kit, this test detects a hormone that comes from the placenta.
Your test is positive, and we want to go over.
Next, along with the physical exam, comes an important calculation. The due date will be the basis for scheduling many of the diagnostic tests.
And with that information, that will give you a due date of March 23rd.
The due date is often estimated as 280 days from the first day of the last menstrual period, not from the moment of conception. The trend in the medical community is to talk about it on a week-by-week basis for each of those 40 weeks. Pregnancy is also discussed in terms of trimesters, each about 13 weeks.
No matter how you divide it up, your baby is just as likely to arrive up to 2 weeks before or after the due date, something to keep in mind as you plan ahead.
Report 2. What happens next?
It's called prenatal care, and it's essential. So one of the earliest decisions of pregnancy is selecting a health care professional to guide it. Maureen Weiss and her husband made a traditional choice. She's seeing an obstetrician-gynecologist. Another option is the one chosen by Luz Serrano. Her pregnancy will be monitored by a family practice physician.
Basically, in our specialty, family practice, usually what happens is that we take care of the whole family.
For Sandra Mann, a certified nurse midwife will be the primary caregiver from the moment the first heartbeat is heard through delivery.
There it is.
Certified nurse midwives are registered nurses who have completed specialized education programs to care for women's gynecological and obstetrical needs. All certified nurse midwives work in collaboration with a doctor in case complications arise.
The way we work our practice is every pregnant woman rotates between seeing the three of us. There are 2 nurse midwives and 1 obstetrician. And the nurse midwives do the majority of the patient education.
In addition to your personal preference for a particular doctor or nurse midwife, there are a number of practical considerations, including what hospital or birthing center does the doctor or nurse midwife use to deliver babies? How far away is it from your home or work? And does your health insurance cover the kind of facility and the practice you're considering?
Another important issue to consider is the risk of a complicated delivery. Depending on your age, your overall health, and other concerns, you might be a candidate for an obstetrician gynecologist who specializes in high-risk maternal fetal medicine.
The reasons why a patient might see a high-risk specialist would include any patient who's had a previous pregnancy loss or an abnormal outcome. That would be a miscarriage or repeated miscarriages, a late miscarriage, a premature baby, or somebody who's had a medical illness coexisting with pregnancy.
Hello. Hi there.
Angela Ish is considered high risk because she has diabetes. Some other medical problems that could put a mother into this category include high blood pressure, heart disease, thyroid problems, and epilepsy. The doctor or